And then next up, we can bring the child advocate, right? So Jennifer Griffith, I see you online. Go right ahead, introduce yourself, and just talk about the issues and stuff that you're facing.
What kind of time do you have, Chair? No, so I just wanted to ask, always starting with a joke, see who's paying attention. So do you want me to speak to, Chair? I have several things I had submitted through Mr. O'Brien, one of which being my support or my feelings on the DCYF budget, and then I have a separate letter about my own. So which would you like me to, do you want me to do DC, whatever you'd like me to do first, I will.
I would say do yours first and then go DCYF, and then they can follow up right behind you.
Got it. Okay, sure. I'm happy to bounce back in between it if needed. I've submitted to you just longer than my usual, but we had a lot to say this year. It's just a five-page letter about my agency, and I just want to thank you for taking the time. And also, I do want to acknowledge with me on WebEx on another square is the Assistant Child Advocate, Attorney Caitlin Madeira. So she and I are both here to answer any questions that either you or anyone else in the committee would have for us. I know you've received my letter. I will try to keep it quick and to the point as I usually do. I always think it's important. One, I do want to thank my employees, and just for everyone's reference, I have a staff of 8, that would be me included, to oversee the ever-changing number, not a slight to Sharon, Kevin, or anyone else, of 600 and change of employees who work at DCYF, to oversee about 7,000 children in care. So our 8 looking at their 600 versus 7,500. So I just want to acknowledge my staff and how thankful I have been for them always, but particularly in this last year. With that, I do want to say, because I don't think the DCYF employees get enough positive feedback, and this may sound strange coming from me, the lady who is paid to sometimes give negative feedback, but I want to be clear and acknowledge the people who work at DCYF in any year, but particularly this year, when they went to work every single day. And I want to make sure I say, those at the Rhode Island Training School, those who are working investigations, those who are working in FSU, the technicians who support the kids and drive them everywhere, anyone who worked there, I think they should be acknowledged for the hard work they always do, but they particularly gave us and the clients, these children and their families, in this last year. So my office is a statutory authority. I run an independent state agency, and though Director O'Coin and I enjoy a very nice professional relationship, we are 2 separate state agencies, with mine providing oversight to his. So the list of things, and I thank Sharon as always for the slides, which I'm always very thankful for. I want to be clear that of all the New England states, we do the most of any of the New England states. And for the rest of the country, about 30 states in the union have a child advocate's office, and ours, I'm very proud to say, does more work than most all of them. So our statutory authority is quite broad. Not only are we the agency who writes the fatality and near fatality reviews, and I just want to be clear, not a way, in case anyone's wondering or asking, at present time, we are not working on any full panel reviews of any near death or fatality. So I think that's important to note. But we have done 3 since I've been the child advocate required by statute. We also are in charge of monitoring all placements in and out of state. I'm very glad that we've kept up with that. Just 2 of my staff this week, they're being at school vacation, are out and about around New England, making sure that we are at every placement and we know who's working there, who's living there, and what they need. So I'm very, again, thankful for my staff for the continued work with that. We have, each year, we have continued inquiries that have gone up exponentially each year. This past year of 2020, and we've just included for your reading pleasure, our annual report as well, to show you that the number of inquiries we receive from those all across the state, and I have to point out the highest number still being those who still work at DCYF, to let us know of issues that they're working with or having a problem with. Each year, we continue to have more and more of those inquiries. I also would like to note that we have a lot of court involvement. I myself are appointed on numerous cases. Ms. Medeiros is as well, and so is Attorney Robbins, my other attorney. So I got 3 calls just this afternoon from different judges letting me know of my new appearance that would be required as of the next week. I'm thankful for that. This is not a complaint. This is a statement letting you know that we are heavily involved in our court, TPRs that are taking a long time, cases with a variety of issues. We remain present in the court, WebEx or in person, to be advocating for these children and young adults. I also want to be clear that we independently investigate a lot of concerns that, for example, judges may have brought to them in their courtroom about different placements. That has continued throughout the pandemic. One of our, I would say our recent concerns has been the rise in educational advocacy cases that we have found ourselves involved with in court. And I'm thankful for Ms. Medeiros and Attorney Robbins for taking a real strong move towards acting aggressively in these child's best interest to make sure they're getting the proper educational services that they need and require. And about the lawsuit on my website, but I'm happy to either to any representative on the call or any representative or any senator, frankly, I'm happy to have any conversation at length about the children's rights lawsuit. This was a lawsuit brought by 2 child advocates ago. And this was a lawsuit brought in 2006 about the lack of proper placements for children. In 2006. In 2021, I still have concerns about the lack of proper placements for children. This lawsuit has cost millions of dollars. I think it's important to note here, not $1 has ever gone to any child. This is for lawyers' funds and for continuing legal issues. So I was given the role of monitor, and I do want to thank Speaker Mattiello for giving me that position, which I'm very, very thankful for the amount of work that it has generated and we continue to generate. We have, in a timely fashion, filed 4 reports for 6-month periods addressing the benchmarks which have been laid out by the children's rights lawsuit. I was not part of it. I became the monitor, I believe 4 years ago when I got this job in 2016, so 5 years ago. And I was given this role to monitor the progress along with this data group, PCG, out of Pittsburgh. So if you're referring to the children's rights lawsuit, we also assume all of that work. I do also want to acknowledge that we do all public education and awareness. We've been working quite closely with the release of the Federal Consolidated Appropriation Act money, quite closely with Director Aucoin and his staff, as well as the Family Court, to ensure we're utilizing every single dollar in the most reasonable way to reach these young people. And this is not a criticism of Sharon, but I just want to make clear with the voluntary extension of care. This is a voluntary program that those who are in DCYF placement at their 18th birthday can transition to and agree to remaining in DCYF care. So they are active cases. I don't want the perception to be that they're just kind of hanging out there in the ether between 18 to 21. We have an entire, when I say we, I mean it with the global we, DCYF has a unit of social workers who each has a very high caseload, not unlike their coworkers, but the VEC unit does very difficult work with young people getting an apartment. And this, I know this is not the housing, Commission on Finance, but I want to be clear, housing remains one of the biggest issues that our young people are facing, just to get an apartment. The hoops in which they must achieve through 1 hour or 1 day just to even get into an apartment that is safe and affordable is insurmountable for someone my age, never mind someone 18 to 21. So I just want to be clear with that these are young people who have never gone home, their parents' rights have been terminated, they're missing in action, deported, in prison, deceased, otherwise unavailable. They are on their own, they have never been adopted, but DCYF is able to work with them. So they are an active caseload for that VEC unit. I just want to be clear on that. With that, we've done a lot of, I would say, ancillary work with the DCYF over the last year with this, these fundings that have come from the federal government, ensuring that we're making sure that every child can get a driver's license, every child can be in the right school, they can receive the vocational, educational training of their choice. And again, I thank my staff for being so committed and really putting it out there to make sure that everyone gets the word on what it is that we're offering this group of kids. So I'm very thankful for that as well. In the letter, you'll also see, as I write about the recent challenges we've had in the last year with the lawsuit, the increasing calls about our increased court representation. And I just would like to say previously, I believe about 15 years ago, the Child Advocate's Office once housed the contract for educational advocacy. That is something, I'm going to be clear, I think needs to be returned to our office. I will assure you, we will act in a zealous manner as we do with everything else. And I think my office is best poised to have that contract returned to us. As of right now, we do not receive any funding. I've never sent a bill, and nor do I plan to. I wouldn't even know how to. But I want to make clear that we are getting involved in every case we are asked to simply because it's the right thing to do and we need to do it. But I'd like to get some increased funding, just a preview of coming attractions. I'd like to see that contract returned to my office. With the budgetary challenges, I also do want to say to the committee that I had last year, pre-pandemic, as you know, we submit these in the September. We did not know when we submitted it in September previous that we would be facing the challenges that we have. I had asked for an equitable increase in all of my department salaries, all of us together. They were all reasonable. This was on a national scale that we looked at, and also similar jobs within state agencies, such as DCYF. There's a lot of disparity there, and I just felt, with the work my staff puts in, that we needed to be on an equitable working ground level financially. So I withdrew that because I did not want to be perceived as being foolish during a pandemic year trying to grab it. But I will say it was only $113,000 to make us right. So it was not, insurmountable amount of cash, but I did withdraw it because I just didn't think it was the right year to be asking for that. At this time, our budget, as Sharon mentioned, we are mostly personnel in a state building with no state cars or overtime, but we are primarily personnel, and we do plan to hire that 9th person back now that we've been told by the DOA through Governor Mckee, which I'm very grateful for, that we can hire that 9th person. So that's the sum and substance of my my presentation to you. As always, I'm happy to answer any questions, because I know you do have a lot of people to testify tonight. And Chair, whatever you'd like me to do, I could answer on that and then move to my other letter about DCYF's budget, whichever you prefer, Chair.
All right, let's see if we have any questions on that. We can marry the two as well. So I would recommend that you can just keep going on. You're on a roll. Okay. And then we can just have all the questions after.
Okay, fair enough. So again, at this point, I'd like to transition to testifying about the budget that DCYF has submitted to you for your review. Now, in the last 5 years that I've been the child advocate, I want to be clear that my office and I have firsthand seen the results of an underfunded DCYF budget. I was so pleased to hear Dr. Nicole Alexander Scott talk at length, and I'm always so interested in her presentations about how we're the leader in this and we're the leader in that, and I'm very proud of that. What I'd like to see is a DCYF budget that I could also be proud of, frankly speaking. Every death review that we have written has had a series of recommendations about particular issues and cases, particular systemic problems, but one that always seems to be addressed with all seriousness at the time, but not always carried over in a continuous fashion, is that FTEs have consistently gone down through the decades at DCYF. Now, yes, have there been population changes? But as we have just learned in the paper, we are not losing any districts, so we are not in this stable decline. I keep getting to the point of every death review, we talk about the national average for cases and how many a social worker should have. We are always double, 2.5 times, 3 times. This is not acceptable. So to me, I would like to make the continued pitch, and I don't mean this in any disrespect to anyone on this committee or anyone in years before, but a continued pitch for let's make these caseloads manageable. They're not. It's not fair to these social workers. It's not fair to these employees of DCYF. Give them a caseload that they can work with instead of fighting the clock every single day. Every death review I have written has led with that. So I'd please ask you to really consider the testimony of those who have submitted it verbally or in writing to you tonight about actual caseloads at DCYF. Also, the workload of the frontline staff is a longstanding problem, so much so that in the children's rights lawsuit, yes, DCYF has achieved 3 of their 12 benchmarks. I am glad to let them out of them. I'm happy when I can say to, when I write the emails to say to them, we are glad to let you know, because I want there to be success at DCYF. I want to be clear about that. But the things that continuously lag behind are sibling visits, case management, visitation in general with parents and children, and case planning. This goes right to social workers simply having too many cases on their caseload. And I do look forward to receiving the workload study that is required by the settlement agreement from Dcyf. And I get assurances from Director O'Coin that is a coming attraction. I know, I just also do want to mention, and I know there was a hearing a few weeks ago on this, that I am in full support of updating the antiquated Rhode Island Children's Information System, otherwise known to us as Richest. This is an old school, originating in 1984 with limited upgrades through the years. It's very difficult to navigate. It is not user-friendly. And many issues that we're now tracking, lawsuit or not, are really difficult to embed in that. I am not a computer person, but I can tell you it's very difficult. It's hard to upgrade. It just simply doesn't make sense for us anymore. So you can refer to my other letter on that. Otherwise, in general, about the Dcyf budget, I know there was some talk about foster homes, the Rhode Island Training School, out-of-state placements. I just want to be clear that I think one of the issues we have worked most extensively in the time I've been the child advocate is the need for more placements of a high-end level here in Rhode Island. Again, this is not to disparage or speak poorly about any program that's presently operating in Rhode Island. However, I do not like, and I continue to have a problem with, an over-reliance on out-of-state placements that could easily be recreated here. My reasons for this are as follows. One, as a former Rhode Island Legal Services attorney for 10 years, the idea that a client's child would be out of state. Now, what out of state might mean to you might mean something different to your neighbor, but I would say this: if you're without a car, if you have a schedule that changes, you are relying upon RIPTA, or your funds are low, you do not have the funds or the ability to go visit your child in Western Massachusetts. It might as well be Western California, okay? It's very hard on social workers to get up there, and for me, for a child to then step down with transition to a different program here or return home, it is very hard for him or her to then find a new counselor who knows all their business and go through all their problems and seek help on an outpatient basis. We spend a lot of money, well-meaning, on out-of-state placements in Massachusetts where we could easily have those recreated here. I like to say this: one of my all-time favorite placements is the Rhode Island Training School. I encourage all of you to take a trip there to meet the dedicated employees who work there, many of whom have had career, years, decades-long career there, and many of whom have extended or advanced master's degree in counseling, social work, and therapy. The young men and women who are sent to the Rhode Island Training School receive outstanding care. And many of them do reach out to the JPWs or the shift coordinators or people in administration after they have left because they have a bond with them. So I would encourage you to always, realize that if we have this new building at the training school, let's try to use it to its maximum potential before we start moving elsewhere, because it really is an outstanding placement. In that, I'm pleased to learn that October 21st, we'll be working on our 2 new girls placements. I viewed probably in the last few years at least 70 properties, residential, commercial, abandoned, you name it, with Ms. Medeiros and Dcyf and the family court to try to identify a placement. This is a step in the right direction, which I'm thankful for, but also not, to the detriment of the boys, I don't want to exclude them, that there are some young men who are out of state too that could benefit from a newer in-state placement. I'm not suggesting that we don't need to recreate specialized placements. If there are very particular medical needs that we have to utilize an out-of-state placement for, I'm okay with that. But if it can be done here, it should be. It brings jobs, it keeps families together, it keeps the young person, close and in proximity to their family and into their clinical team, and they're better able to access it, when they get out of this high-level program. And we have many employees who I think could be definite an asset working in one of these programs. So again, I just would encourage you to consider the testimony of the high caseloads. It has been a consistent problem in my last 5 years as child advocate, and that's basically the substance share of my testimony for both agencies. Thank you.
Thank you very much. Any questions of the advocate? Anybody online have questions? Nope, I think you touched upon it, but just looking at like slide 40s, and it's slide 40, slide 41, slide 42 with regards to the commitment achievements and everything like that, and how
Sure.
you do see a lot of like no-nos And I think you touched upon it. Just these are no's because the social workers are just overloaded. Is there any disconnect in the data inputs or anything like that, or you think it's solely because it's just the social workers are overburdened, they're not able to be doing these steps?
Well, I mean, you can't be 10 places at once, right? And we can all have aspirations in the morning. I know I certainly do each day, and I'm not getting them done myself. So I will tell you that I don't want to say, oh, the reason number, for example, I'm just pulling up, if I'm looking to the side here, Chair, it's nothing, I'm not trying to be disrespectful, I'm pulling up Sharon's slide on page 41. I don't want to say, oh, this is a social worker problem, but sometimes the sample sizes, which is a recurring issue we have about the remaining benchmarks, sometimes it's my position and the data validator's position that not only are these caseloads unrealistic from the get-go, but the data system at this point, so you use casework face-to-face. I want to explain a little bit more about that. That is basically saying that a social worker on their caseload has to go visit every family, every child, every parent each month face-to-face. That is very difficult to do with court, going to meetings, driving in the car. Let's not discount driving in the car. Bringing food here, bringing clothing somewhere, going to school, going to an appointment, setting things up. That's a lot. And again, I will say there is some, with the richest system, there are some times that if the wrong box is checked off, it throws off everything. And I want the right box to be checked off, and I want them to get the credit for the work they've done. But as you see, and as you say on page 41, for example, it's 4 no's. And listen, I'm no predictor of the future, but if we continue at the same level of cases for the FSU workers, they're going to get some more no's here. Because it's impossible to do. It's like the impossible situation. So that is why many of the other ones were more administrative things, but there's a lot of these that are going to take some time to achieve, much more time if they're not given some more people to do these cases.
Thank you for that. It's I recognize that people can't be 10 places at once, but even just on slide 40, the section 1 assessments completed when entering care. So you would imagine that's a situation where there is that one-on-one interaction. So how could that not be accomplished?
You are on which one? I'm sorry, I was listening to you, but trying to get my screen on the right one.
So it would be the slide 40, and it's section 1 assessments completed when entering care.
Yeah, we have continued disagreements about what type assessments we're talking about. A dispute about which assessment is appropriate at what time, and we always seem to be in dispute about whether the sample sizes that we are being provided or which we have been provided to us have been enough to make a reasonable assessment of whether something has been achieved. So actually, Chair, I think when you bring up Section 6 or simply place more Section 6 about, that just goes to show you this is with the FSU worker working, nonstop. This is something that's been quite difficult to achieve.
Okay, thank you for that. Because when I was looking at this, doing the review prior to the meetings, I couldn't understand how that wouldn't be met. But that makes more sense, and I think Director Aucoin would be able to talk about that in further detail. And then moving on, just even a couple of slides over, with regards to the accreditation, can you speak upon the steps that are occurring with that? Are we going to move forward? Are we not going to move forward? Is it not moving forward because of a specific reason, or is that Director Aucoin can do it?
I have not heard much about the accreditation. I think Director Aucoin would be best to answer that for you, or perhaps if anyone else, maybe for us in the unions here, but the Council on Accreditation, I think Director Aucoin could best answer that.
Okay, not a problem. Any other questions? Nope.
Chairman?
Thank you very much for your testimony. Representative Quattrochi.
Thank you, Chair, and hello, Rep. How are you?
Hi, thank you, Chairman. So Jennifer, maybe you can refresh my memory. It was last year or the year before, maybe, based on your important work and recommendations, that did we approve funding for a certain amount of frontline workers?
I believe It was 2 seasons ago. I do believe that your caucus did put in a proposal for more workers. How many exactly were enacted from that? And I will say, I do want to be clear that I do know that DCYF runs a continuous hiring campaign. It's not that it's ever been on hold. There are consistently new people coming on, but there are also, today I learned of at least 10 who are leaving. So it's a revolving door in that sense. So yes, I know that has come up, and I remember you and I speaking about it, I think 2 years ago. Okay. You were asking me about that as well, yes.
I'm sorry, my memory doesn't go back that far, I guess.
I may have looked at it earlier in case it came up, so please don't be upset about that.
Oh, okay, thank you.
All right, any other questions? No? Jennifer, thank you very much, as always. Comprehensive and very knowledgeable. Thank you for all you do.
Thank you very much. I appreciate that, Chair.
You got it. All right, Director Aucoin.
Just making sure my mic works. Can you hear me okay?
It does. I can hear you perfectly.
All right, perfect. Thank you. Good evening. Thank you, Chairman Mazurkowski, members of the Subcommittee on Human Services, for the opportunity to speak to you tonight regarding Governor McKee's proposed budget for the Department of Children, Youth, and Families for fiscal year 2022, as well as the revised budget for fiscal year 21. The department's mission, as you know, is to partner with families and communities to raise safe and healthy children and in a caring environment. To be successful in this work, DCYF prioritizes ensuring that timely support is available for our children and families so that families can access services that they need and when they need it. The department continues to shift its practices, which are grounded on family engagement. We utilize a race equity lens to view all of our work, and we are committed to collaborating with communities and stakeholders to address the specific needs of children and families that we serve. Before I actually get into the budget, I would be remiss if I did not address the agency's work over the last 12 to 14 months. As Dr. Alexander Scott referenced, the pandemic presented all of us an unprecedented challenge. And that was very much the case with the Department of Children, Youth, and Families operations in child welfare, juvenile justice, children's behavioral health, and in our resource family unit. During this time, the department's child abuse hotline experienced a decrease in the number of reports made based on restrictions that were in place and the implementation of distant learning in the schools. Notwithstanding the reduction in those calls, our child protective staff did continue to respond to the child abuse and neglect reports throughout the pandemic. And that included in-person response and meeting with families, meeting with children, and doing what they needed to do to ensure that the child is safe. It's important to note that as we sit here today, the calls to the child abuse hotline have started to slowly return to the average call volumes that we had pre-pandemic. Additionally, the department during the last 12 to 14 months had to reimagine how it conducted its business. During the pandemic, our staff continued to conduct face-to-face contact with parents, face-to-face contact with children. We were able to use virtual connections, but we did not fully stop our face-to-face contact with children and parents. We also continue to actively pursue foster care licensing. We provided our staff, the training school, provided care and custody for youth who were under care at the training school. And our juvenile probation staff continued to exercise community supervision to our youth and that were placed on probation. And at the same time, we also continued to coordinate the delivery of behavioral health services to children and youth. I'd like to publicly recognize and thank all the staff at DCYF for their heroic efforts over the last year. Also during the pandemic, and I think you've heard a little reference to this, Sharon did a great job with the presentation as always, that we did promote increased flexibility for our staff by allowing our staff to telework during the pandemic. Investments were made actually prior to the pandemic, and then during the pandemic, investments were made to increase the department's mobile infrastructure, IT infrastructure, that would allow the department to quickly support a mobile workforce throughout the pandemic. During this time, we have seen a increase in staff productivity and workplace efficiency due to those innovations. I should also mention, as was referenced in the presentation, that Governor Mckee has also included the provision under Article 4, Section 6 to replace the antiquated riches system. I testified in support of that budget article, and I would emphasize that it is critical that the information system, the riches system that is over 20 years old, it is absolutely necessary to replace that with a new comprehensive child welfare information system to be able to continue the gains that we achieved by creating this increased IT, by enhancing our IT infrastructure, and by creating this mobile workforce at Dcyf. At the same time, as we were experiencing during the pandemic and seeing that there were more families at risk, more children in crisis, we continued to innovate throughout the pandemic. Our child protective team was out meeting with several of the larger school departments and discussing with them the availability of family support services that could be accessed in the community. In addition, the department created and launched a support and response unit in the end of September 2020. That unit connects at-risk families with targeted support services on a voluntary basis, which is aimed at preventing child maltreatment and promoting child well-being. As it is past Monday, the support and response unit has reached out to 682 families since the end of September 2020. To support that effort, we created a toll-free family support line that Rhode Islanders can call if they need assistance. This is strictly voluntary and strictly confidential. Notwithstanding the challenges we faced over the last year, the hard work of Dcyf staff is reflected in some very compelling outcomes that we've achieved. Today, as we sit here, there are fewer children in out-of-home placements today than there were before the onset of the pandemic. We have over 200 less children in out-of-home care today than we did back in January of 2020. We have seen the rate of discharge from care far exceed the rate of entry into care. So what that means is we have more children who are leaving care and safely going home, and we have less children entering care or being removed and placed into Dcyf care. That is a very good indicator of a strong child welfare prevention system, and a system that is predicated on making good and timely assessments of families and engaging families in a very productive way. At the same time, of the children who do enter care, we have more children placed in foster families, placed in family care, than we ever have. So all children in out-of-home care, 81 to 82% of those children are placed in a family setting. Of that 81 to 82%, 70% of the children are placed in an approved relative or kinship home. Those are all-time high numbers for Dcyf. The number of children placed in congregate care during that same period of time, basically from February of 2020, March of 2020, has decreased by 15 to 18%. And as I sit here tonight, I would tell you that the primary reason for that is that there are more family options being pursued for children coming into care than there were prior to the pandemic. So we've decreased the number of children in congregate care from 389 children in February 2020 to 321 children as of March of 2021. It's important to note that the governor's budget for FY22 will allow the department to sustain and build on these outcomes. I just want to take a moment now to talk about the two budgets that are before you tonight. And I think Sharon did a great job on both of these. The FY21 budget does include an increase of $1.2 million, all funds, over the FY21 enacted budget. And Sharon hit on the justifications for that increase. And they were related to COVID initiatives, as well as, and this is COVID related, the temporary expansion and a voluntary extension of care. The COVID initiatives that are impacted by this funding was the department's efforts and work with our providers. This was a public-private partnership, and our providers stood up tall on this. Included the establishment of isolation and quarantine facilities for our adolescent youth who were in need of care. That was an absolute critical intervention so that we could segregate the youth as they were coming into care to ensure for the safety and well-being of that youth as well as all other youth and programs. The isolation sites were absolutely critical in that if a youth in a group care facility had a COVID positive test, we had the option of placing that youth in one of the isolation sites as opposed to trying to isolate the youth in a group home environment. So we are very appreciative of the support we received from the provider community and their efforts in helping us successfully manage throughout the pandemic. The FY proposed 22 budget, Governor Mckee's FY22 budget, reflects an increase of all funds of $8.6 million over the FY21 revised budget. Excuse me. And as was mentioned, and I'll be very willing and eager to answer questions about our Fte Cap. The FY22 budget provides an overall increase in the department's FTE statutory cap and allows for continued intervention or investment in child welfare practice, children's behavioral health, and the expansion of prevention initiatives. Specifically, the government's FY22 proposed budget that I want to highlight involves funding to help support our launch of our Family First initiative. So the budget includes funds to support the department's submission of a Family First prevention plan. The department expects to submit this plan to the federal government in June of this year. This plan will allow the department to draw down for reclaiming for some of our community-based programs. And it would really only apply to evidence-based programs and evidence-based programs that we are currently not receiving Medicaid funding for. The Family First effort is a national effort. It's predicated on a congressional act, the Family First Prevention Services Act of 2018, and reflects a shift at both the national and state level of practice regarding the emphasis on prevention planning. Is it a complete and fundamental shift of doing the way we do business in child welfare practice? As a result of this shift, we do expect to see a reduction of the Title IV reimbursement for residential care. And in that regard, Governor Mckee is proposing in his budget an additional $385 in general revenue to offset that loss of 4E revenue for residential care. The staffing in the FTE. So to clarify, the existing FTE cap for DCYF in the FY21 budget is 617.5 positions. Governor Mckee's budget proposes a net increase of 10 FTEs for the FY22 budget. So that would move the cap to 627.5. The 12 FTEs would be to support filling of positions in our Resource Family Division. Last year, as you recall, the department launched an effort that we refer to as right-sizing of foster care. That is both a public and private joint partnership, an initiative that reflects a joint public-private partnership between DCYF and 10 of its provider foster care agencies. The overall goal of that initiative was to license 100 foster families in fiscal year 21 and an additional 100 foster families in fiscal year 22. Through the collective efforts of DCYF and our provider agencies, I am pleased to report tonight that as of today, the DCYF and the provider agencies have licensed 153 non-kinship homes. Okay, that exceeds our goal for the entire fiscal year. We have now capped this as Rhode to 200, as we are now moving on to achieve our goal of increasing and licensing the number of non-kinship foster homes to 200 by the end of next fiscal year. The increase in the Fte Cap will allow us to backfill those positions that were created in 2021, at the beginning of 2021, to support the resource family unit. What we did was we created those positions, and it resulted in staff moving from our family service units into our resource family division. The funding, the increase in our Fte Cap will allow us now, if it is approved, will allow us to backfill those positions. So that'll actually be a net increase, and this goes to what Jennifer was talking about in workload and caseload. It'll result in a net increase of 2 additional casework units in our family service division. The budget also includes an additional 4 FTEs for additional child protective investigators. As I mentioned, yes, we did see a reduction in the number of calls for the child abuse hotline during the pandemic. However, as we sit here today, we are slowly approaching the pre-pandemic levels of reports to the child abuse hotline. By having 4 additional child protective investigator positions, it will enable the child protective division to be able to timely respond to these reports and conduct thorough investigations. We need to avoid going back to days where we had investigators getting double assigned for investigations. So these are very critical positions to fill, both the family service division positions as well as the child protective. And as Sharon mentioned, we do have a request to seek funding for 2 paralegal positions and 1 utilization management position. On the paralegal, let me just quickly say that our legal office is a very busy office. Every year, we file in excess of 1,200 petitions in the family court, child welfare petitions of varying types in the family court. We have 10 attorneys, and we have 1 full-time paralegal and 2 contract paralegals. We are recommending that we end up with 3 full-time paralegals to help support the attorneys and ensuring that cases are adequately prepared to go before the family court. So that is a compelling need for us, and has been a compelling need for us for many years. On utilization management, that is absolutely critical. This person will certainly ensure that children and youth who can be in a family setting whenever possible, based on their level of need, will get to a family setting. But just as important, this person will also evaluate the youth and children that are placed in high-end residential and assess whether or not, by doing a utilization management review, whether or not those children, or determine when those children or youth are able to step down to a least restrictive placement. We need to institutionalize that within DCYF, and this is a great opportunity for us to do it, and we're urging for support. We're urging support for that FTE. Separate from the FTEs, yes, there is discussion about the training school. We have seen a pretty significant, Sharon had the data out there, we've seen a very significant decline in census at the training school. Sharon's chart has it right up to FY20, and the average census through FY21 actually is 21 youth at the training school. And so you sit here tonight, there are 27 youth currently at the training school. So as we've seen the decline in the census over the last 5 years, the department and Governor Mckee's budget would recommend that there be a reduction of 9 FTEs to reflect this change in the census. I should note that the department has not been backfilling vacancies at the training school for well over a year now because of the declining census. Also, as of February of 2020, the department was able to close one of its 4 units at the Youth Development Center. That actually turned out to be key. Now, February 20, no one predicted that we were going to be in a pandemic for the next 12 to 14 months. That turned out to be a very key intervention. That gave us the flexibility to use that closed unit to quarantine and isolate youth who had symptoms of COVID or who tested positive for COVID. And that certainly helped us prevent any serious outbreak at the training school during the last 12 to 14 months. But as a result of these efforts, as we sit here today, while there would be a reduction of 9 FTEs at the training school, okay, we anticipate that the FTE reductions will be achieved by a natural turnover and will not result in any layoff of training school staff. So that is certainly good news for us, and it does reflect the efforts that the training school has been making over the last year or two to be able to reduce its personnel costs based on the declining census. The PRTF issue in the high-end residential. I should start out by saying that while we've had a decline in our congregate care numbers, and 15-18% is pretty significant, the demand and need for children and youth who require high-end residential care has remained consistent throughout the pandemic. Okay, part of the issue during the pandemic was, while our numbers with high-end residential went down a little bit, the problem there was the programs, both in-state and out-of-state, put a hold on admissions for youth going into high-end residential due to the COVID risk. Well, the holds on admission have now been lifted. So we are seeing a return to pre-pandemic levels for youth and high-end residential. Jennifer is absolutely correct. We are seeing an increase in the number of youth being placed in out-of-state placement. And this proposal here contemplates that the state would create additional capacity for psychiatric residential treatment facilities, particularly for female adolescents, in state. We currently have one program, St. Mary's Group Home for Children, that houses a psychiatric residential treatment facility for up to 14 female adolescent youth. That's not enough. Okay, as of April 1, there are 27 adolescent female youth who are placed in out-of-state behavioral health facilities due to the unavailability of in-state psychiatric care options for that child. So this is a critical piece that we've been working on collectively with the family court, with the child advocate for about 3 or 4 years or longer. And I think we're finally at a threshold where this is ready to go. We have worked with the EOHHS Medicaid office. We've prepared guidelines for PRTF. We posted it for public comment. Those guidelines are in the final stages of being approved, and we will shortly, the Medicaid office for EOHHS will shortly be forwarding those guidelines to CMS for approval. It'll take approximately 60 to 90 days for CMS to approve. So I do think the October 1 start date is certainly consistent with that timeline. We had shared those guidelines with our providers here in Rhode Island. We've had some interest from some of the providers who are willing to consider creating a PRTF facility that we're excited about. And this will be open to any provider. It's not going to go out to competitive bid. Any provider can come forward and declare that they want to convert or create a residential treatment program to be operated as a psychiatric residential treatment facility, so long as they can satisfy all the requirements of the PRTF guidelines. Another area I just want to touch on, I think there's been some discussion on it, on Dcyf funds. So Governor Mckee's budget does provide additional funding to support the department's initiative and the mandates that were imposed on all states through the Consolidated Appropriation Act of December 2020 there is funding in the governor's budget of $450 to help us stand up and create an infrastructure to support youth who had aged out of DCYF care during the public health crisis, as well as youth who had previously been in DCYF care, young adults who had previously been in DCYF care, to receive Chafee support through age 26. This is a temporary expansion, though, of eligibility, as the temporary expansion the temporary expansion part of this will end as of September 30th of 2021, but the ongoing delivery of the financial support for these young adults will continue until the funding is exhausted, or at the very least through September 30th of 2022. The assistance that the young adults can receive through this funding includes financial support for housing, utilities, furniture, education, and job training. The last thing I just want to mention very quickly is I'd like to publicly express my support of the governor's budget as it relates to additional investment of funds to support individuals and families with suitable and affordable housing opportunities. As Jennifer knows, both her office and at DCYF, we've done our best to mitigate housing problems for children, youth, and families that we serve. During the past year, DCYF has established a housing liaison officer and has expanded our housing navigator capacity via the Family Care Community Partnerships. We continue to work in partnership with Rhode Island Housing, the Office of the Child Advocate, Rhode Island Family Court, and our sister state agencies and community providers to identify additional resources wherever possible for our families. More work clearly needs to be done to help support our families with regard to seeking housing assistance. Again, in closing, I want to thank Governor Mckee for his commitment and leadership in these issues. Also want to thank the House Fiscal staff for working closely with our management and budget team to ensure that you have the most up-to-date data and accurate information as you consider Governor McKee's budget recommendations. Look forward to continuing working together to best meet the needs of our state's children, youth, and families. And again, members of the committee, thank you for your time and support this evening. And I'm here along with members of our management and budget team to answer any questions you may have.
Thank you, Director. It looks like we have a couple of questions. We can go right over to Rep. Diaz and then Rep. Slater.
Thank you, Chairman. I appreciate the opportunity to speak with Director Coy. And before I presented to you some statements and questions, I wanted to say up front that I respect the work DCYF does, especially the social workers that I have to see from my eyes the responsibility, the intense training, and so many things that DCYF require in order to become a social worker. As I mentioned, I respect the work, I respect all the things they do, but at the same time, I'm concerned about the number of families they have to manage during the time they are working. The work of social workers involved to be responsible for so many children at the same time, traveling a lot across the state, managing and representing families at court, and so to do so many things in order to keep children safe and providing at least the basic family feelings of be protected and be well assisting in all the needs. So with that in front, I'd like to ask the first question. And my question is, can you please define me what is the frontline workers definition for DCYF in terms to taking care of children and the responsibility that involves?
Okay, so our frontline caseworkers are social caseworker twos, and their primary responsibility is to get assigned cases to provide case management support to the families. Case management support to families has a lot of definition to it, no doubt about it. Their duties are very broad, they're very consuming, and we certainly recognize that. So they're responsible, they handle cases with children who are placed either at home, or they handle cases where children are placed out of the home, whether they're in a foster home, or relative's home, or they're in a group care facility. Their responsibility is to create a service plan with the family and in partnership with the family to identify those areas where the family needs to engage in services that will ultimately, the goal would be to ultimately reunite the child with the family. And generally those service plans are at 6-month intervals. I got to say that over the last year, we've seen a number of cases, and I think this in large part is one of the reasons for the decline in number of children in out-of-home care. We have seen a number of cases where the caseworkers have been very successful in their efforts in successfully discharging or reuniting children with families. And then once they do that, they keep the case open to continue to provide service and support to the families. In addition to that, the caseworkers also are a source and provide support to children in out-of-home care. So not only are they working on services to help the parent, they're also working on a service plan that helps provide any service that's identified to address a need for a child or a youth. They are responsible to, as Jennifer said, to facilitate visits. They have an obligation to meet every month face-to-face with all children on their caseload. And they also have an obligation to meet with both the mother and the father on each case. They go to court. The court events over the last year have been pretty much done by WebEx hearings, but there are court requirements. We currently, the caseload, I'll put this out there, the caseload right now stands at an average of 16 families per caseworker for our family service units. During the height of the pandemic, it was actually as high as 17.6. 16 is still too high. Our goal is to get it under 15 families per caseworker, and even better than that. One of the things that Governor McKee's budget will provide, if we get the funding for the 12 additional FTEs that previously supported funding for our resource family unit, that will afford us the opportunity to backfill those 12 vacancies for our family service units. And that would add 2 additional units to our family service division. That would have a very strong impact on our staffing at DCYF. I must say that over the last year, we have continued, and notwithstanding the pandemic, our staff development office has been very successful in running orientation sessions, 3 orientation sessions for new staff. So we brought in a new orientation, a new group of social workers in August of 2020, another group in December 2020, and yet another group just began in March of 2021. As we sit here tonight, all but 5 casework vacancies in our family service units are filled. And that is quite a low vacancy rate for caseworkers. We are planning to run another orientation and hire another group of social workers sometime in July and August of this year. That will afford the opportunity to continue with this cadence of ongoing filling and recruitment of social work positions. Obviously, if we get the funding for those 12 positions, we will add those positions to the filling of casework positions. I would much prefer to have all those positions come on board at the same time in July or August, so we can have one training class as opposed to having separate training classes.
Director Coyne. As you mentioned right now, the department is engaging on putting together a new opportunity for training and recruit. I will humbly suggest that something has to be done in order to keep the staff after be trained and recruit and working. The turnout in the department is high. People get the opportunity to become a social worker and then they move to another department. So in some way we need to figure it out how we retain those social workers in order to really make significant improve based on the institutional knowledge that each one of them bring from the experience. But moving forward, because it's a little late for old lady like me, and I want to go home, I just want to move you to another part and make a question. According to the budget that we have in front of us today, and the information was previously provided to us, for the FY 2021, we knew that we already have 40.5 positions vacant. For the INAT budget that we have talking today for the FY 22, the vacancy increased to 48. Now, can you tell me if those 48 vacancies that we will try to in some way to at least approach to fill those vacancies are all frontline staff, are all positions that we working directly with families from the department, or can you give me some distribution of those possible vacancies that we planning to fill it out?
I think what I'd prefer to do is we can provide you with the list of our current vacancies within the department. I can tell you that today we have 5 casework vacancies and we have 2 child protective vacancies. We are currently seeing some fluctuation with our staffing as we have a number of staff that are exercising their right to go through the voluntary retirement program. As of the data that I think Sharon provided you was as of April 10th. I can tell you that as of April 24th, the number of FTEs that we have in our payroll is actually going from 589 to 595. But that number keeps fluctuating. We can get you, I'm not sure where the 40 is coming from, because even at 589 or 594, if our FTE cap is 617.5, it wouldn't be 40. So I think we can provide that list of the current authorized positions of the 617 and how many of those, which ones of those are vacant, and which ones of those are frontline positions.
Thank you so much, and please include in the information how many of them will be part of the future training that you mentioned recently.
I guarantee the 5 social workers would be.
Yes, and that is a deal between you and this finance committee to provide a list, right?
Right.
And my last question, Mr. Chairman, and I know it's late. What is your plan to prepare your workforce for very possible surge in report to Dcyf or abuse and neglect when children return 5 days a week in person across all Rhode Island? What is your plan, Director Coyne, please? And it will be my last question, and I would love to hear from you. Thank you so much, and good luck.
Thank you, Representative Diaz, as always. Your questions are very good and very direct, so I like that. Our plan actually started during the pandemic. We realized that as the youth and as children were being homeschooled or doing the distant learning, that we needed to reach out to the school departments and make sure that we had a coordinated level of being able to provide support to at-risk families, at-risk children during the distant learning process. We've begun to see the increase in the number of reports. So part of our request is the additional 4 FTEs for child protective investigators. As I said a couple moments ago, we right now have all of the child protective investigator positions filled but 2. There are 2 vacancies. they will be part of our recruitment that we're going to do for the July-August training class. We continue to actively screen all reports in the hotline. Not every report that comes in meets criteria for a child abuse and neglect investigation. So far, we've been able to manage, even with the increase in the number of reports in the hotline, we've been able to successfully manage the caseload within our existing staff. So we'll continue to do both the efforts of outreach in the community, as well as our efforts in terms of making sure that we're providing due diligence and adhering to our policies and procedures with regard to the screening of reports coming into the hotline.
All right, thank you for that. Vice Chair Slater and then Rep. Quattrochi.
Good evening, Director O'Coin. How are you tonight?
Very good.
Good.
How are you doing?
Good. I'm doing well, thank you. Nice to see you. I had a question. I know you were talking about the legal team over at DCYF, and I had a question that the 4 attorney positions that were transferred to EOHHS in fiscal year 21, the enacted budget, are they still with EOHHS for the fiscal year 22?
I believe the answer is yes. I do see our executive counsel, Pat Hessler, is on this call. Pat, do you have any, the current status of those positions? Oh, maybe she's not on the call.
Okay.
I thought I saw her name.
Oh, she just popped up.
I believe that they are. We can verify that, but I believe that they are at EOHHS. There is also some of those positions were not actually funded. So I don't know if those 4 positions were actually funded. But my recollection was they were actually funded and filled positions, and it was just the paperwork to transfer those positions over to EOHHS.
And how many attorneys do you have at DCYF now on staff? Or
I believe that right now we have 10 staff attorneys on staff at DCYF, and we have an executive counsel.
and you have any? Okay. And because I had received some calls and concerns from some constituents about, you know, the legal staff and concerns about them as far as like the training and aspects as far as folks calling in, and maybe that being a delay in some of the adoptions. I don't know if that's something that you've heard about.
Well, we've been trying to work with our legal team. It's certainly a difficult job, and it's certainly been more difficult during the pandemic. Most of the court proceedings now are done by WebEx. However, there are in-court proceedings with regard to termination of parental rights and adoptions. There have been instances where whether the adoption petition wasn't filed by the parent's attorney or a court decree had not been filed by one of our attorneys, those situations have been addressed on a case-by-case basis and have been resolved. I think by and large, the issue of delays with regard to a case is ready for an adoption and the adoption should take place, those I think have by and large been addressed by our executive counsel with the legal team. We obviously don't represent the forced appearance on adoption, so if a petition wasn't filed by the adoptive parent's attorney, there's not much we can do other than follow up with the adoptive attorney, the adoptive parent's attorney, and try to figure out what happened.
And getting back to the child advocate, when she was testifying before us earlier, she had brought up some points and some concerns, and you know, some of them I've shared myself, and one of the things that she brought out is the out-of-state placements and the increasing amount of out-of-state placements. How many out-of-state placements do we have now? And before you answer that, the other piece that she brought up that you're very aware of the facility because you've been over there is the Thomas C. Slater Training School I know we don't reference it that way all the time, but the Thomas C. Slater Training School, and also the staff that we have over there, and the programs that we have. It seems like the facility is not being used, or the census or the population is down, which could be seen as a good thing, but not if we're sending the student the children or the folks that would be served by the training school out of state. I guess there's a couple questions in there.
It looks like we might have some technical difficulties with Director. He's buffering. All right, if anybody on DCYF staff would be able to answer the question from the Vice Chair, jump right ahead. Adam?
Hi, this is Adam Williams, Legislative Liaison. I can at least answer for you, Representative Slater, the question regarding the out-of-state placements. I believe as of a couple of days ago, it kind of, again, changes on a week-to-week basis. There were about 54 out-of-state placements currently. I think it was right around 50.
And it looks like we have the Director back on too, so.
Great, thank you. And as I think was mentioned, about 26 of those are female adolescents. And then Kevin, just to kind of get you up to speed, he had asked about how many out-of-state placements we currently have. And he was also asking about kind of if you could talk about whether or not the training school is being underutilized right now.
Just got to turn your mic on, Director. There you go. Oh, but we still can't hear you.
We still can't hear you, Director.
We see you moving around, but... All right, he's gonna reload or go to...
So while Kevin's buffering or whatever, I'm happy to talk to Rep. Slater about
Jump
the
right
decline at the number of the training school.
Yep, jump right in.
Okay. So hello, Rep. Slater. Nice to see you. So there had been a significant decline, I'd say, over the last decade of those children or young adults sent to the training school, and not all of the mods, are used to capacity. I know there has been a series of discussions, with the union and with administration about how better to utilize, the building, the Slater building, as you called it, spot on. So, yes, and I think when Mr. Williams references the out-of-state, I would say if there were 58 on the particular day that he mentioned, I would acquiesce that, I would say at least, 10%, I'd say at least 10 of that 58 would be for specialized programs that I'm not looking to recreate here. Very specific medical challenges that are rare. Like, for example, there's a placement in Brewster, Massachusetts, where they treat and care for very specific medical needs, and we happen to use it here and there. We don't always have a child there. I'm not looking to recreate that here because it's so specialized and nationally recognized. But I would say of that 57 he noticed, I would say about usually 44, 45 of them are mostly out-of-state girls that could be serviced here in Rhode Island. And the number of lower, it is good, you're right, to have a lower number of, youth, for what it's worth, incarcerated in juvenile detention center. We do have, an extensive community treatment placement situation where they are monitored by probation and court. And if they proceed as they should, they will stay in their temporary community placement, like a NAFI or an Ocean Tides or a Harmony Hill or CSI in Coventry. If they don't, they find themselves back at the training school. So I still would maintain, I'd like to hold on to that building. It's one of my largest regrets that we couldn't hold on to both of them. I will never let that go. So I just like to put that out there. We should have had both buildings with all the girls in the Benton Center. But here we are. So I can see him moving his mouth. So I don't know.
All right, Director, does your mic work?
Checking. Can you hear me?
I can hear you, yep.
All right. So, sorry about that. Sometime modern technology. So, first of all, I believe our last out-of-state placement report, there were over 60 youth in out-of-state placements. I was just trying to find it, but I'm almost certain it was 60. The out-of-state placements, I think I was listening to what Jennifer was saying, it's really not related to the training school utilization. Those out-of-state placements are pretty much behavioral health, mental health, high-end residential placements. It is definitely relevant in a discussion on the psychiatric residential treatment programs. Definitely relevant to that. On the actual utilization in the training school, there are several factors that have gone into it. Over the last 5 years, we've seen over a significant reduction. So we've gone from an average of 75 youth at the training school on average in 2017 to 21 youth in fiscal year 21. We're not done with fiscal year 21. Some of the contributing factors to it is there's more emphasis on diversion. It actually is better outcomes, and the literature tells us it's better outcomes for adolescent youth if they can actually avoid going deep into the juvenile justice system and receive alternatives and receive interventions short of getting into the JJ system. To that end, the family court has its intake unit, and they do a marvelous job in screening every case that comes to their attention. Obviously, it's all about community safety. So if there's a case where community safety needs to be addressed, then that youth will not be diverted, and that youth will be heard in the court, and the training school is certainly an option if there was a valid and legitimate community safety issue. The department itself is working with juvenile hearing boards in many of the city and towns. So we're definitely working with Central Falls, Pawtucket, Providence, and again, the whole effort of juvenile hearing boards on lower end type of offenses is to provide alternatives to youth and alternatives to families for intervention short of getting into the juvenile justice system. In conversations with the chief judge of the family court, he fully supports the use of these interventions, these diversions, because it's proven to show that it reduces recidivism in terms of rearrest and youth entering into the system. For those youth that come in, so that's one factor. The other factor has certainly been the community policing models that have been implemented in a number of city and towns. Providence alone, as we all know, has implemented a community policing model for many years now. In a data presentation that I had the opportunity to sit in on, Providence police have seen a dramatic reduction in both adult arrest and juvenile arrest as a result of their community policing model. Community policing models are also being established in cities and towns like Central Falls and Pawtucket. Those are going to be critical in, again, affording opportunities for families and for youth to seek alternatives to going into the juvenile justice system. That being said, the other factor that is clearly involved here is COVID. So the number of cases that have been referred to the court on the JJ system has definitely slowed down during the pandemic. So as a result of that, you're seeing less youth appearing before the court on juvenile justice cases, and you're seeing less youth being held at the training school. It's important to note that DCYF stands ready, willing, and able to care for any youth that is referred to us at the training school. We have a very dedicated and highly skilled staff out there. Education program, I'm a little biased, but I think they're second to none. They provide excellent services in education for our youth. We see the results in terms of youth who enter the training school and how their math and reading skills increase during even the short time they're there. The average length of stay at the training school is like 6 months. So, it speaks volumes as to where we are in the JJ system today and the changes that have been imposed that have resulted in the JJ system. There are youth that go into detention, and ultimately the family court, in consultation with the Attorney General and the youth's attorney, they make decisions as to whether or not the youth would be appropriate to either go into back home with supervision through our probation or enter into what we call temporary community placement. And we have a number of temporary community placements around the state, one of which is Ocean Tides down in Narragansett, that have had a long history of successful treatment for youth in the JJ system. So there are opportunities out there. There are options out there. Certainly the training school needs to be available for youth where community safety is at issue, and we fully support. In this budget, all it does is reduce the FTE capacity. It does not do away with the Rhode Training School.
All right. Thank you, Vice Chair.
Thank you.
Representative Quattrochi, you still have a question?
Yeah, thank you, Chairman.
Go right ahead.
Thank you, Director. So, currently, the department is not accredited, correct?
Correct.
Has it ever been accredited?
I'm unaware of, I've been here 38 years. I'm unaware of the department being accredited.
Okay.
This was particular to the Council on Accreditation. So there are other accreditation networks, but I don't believe that we've ever been accredited by any accreditation network.
And I'm assuming that would be a good thing, right?
Accreditation, I would say, would be a good thing. Accreditation itself. So if we were accredited, that would be great. I would absolutely, any system that you can infuse more support, more funding, will be a better system. So in this instance, you're referring to the report that we submitted back in October of 20 on the Council on Accreditation. We laid out exactly what would be required for us to receive accreditation. But in that report, we also identified what financial support we would need to achieve full accreditation. And that would basically be, at that time, as of October 20, it would basically need an infusion of approximately $10 million a year in additional staff and support for the department to meet all of the accreditation standards over a period of time. So you could, I think there were, in fact, our recommendation would have been that to implement this over a period of a 4-year cycle for full implementation. By the time you're in that 4th year and 5th year, though, you're going to have a commitment for financial support for the Council on Accreditation.
Okay. I guess my main problem is any other type of if it's so important, I'm sure it is to have this accreditation going down the list of the recommendations for accreditation, and they all have to do with frontline workers, from what I can see. My problem is that any type of funding for extra management positions or full-time positions that don't have to do with frontline people, it seems a little bit disturbing. One of the recommendations was 5 people for a permanent accreditation unit. Have any been filled in that?
No, we have not filled any of those positions that were identified in that report, because if we were going to go down this path, it would have to be with the full support and financial backing to proceed. We have not received any financial support at this point, so none of that report, none of those recommendations have been implemented at this time. No additional staff have been hired. So all the hiring and the frontline vacancies, that's all in the normal course of us doing our business.
Okay. What about, in your budget, aren't you looking for $2.5 million more for management?
I'm not aware of that. Chris and Lindsay? Okay. We have our Chris Hagman, who's our CFO, and Lindsay Callahan in terms of our budget request for FTEs and management.
So we didn't increase any FTEs for central management. It's possible the dollars increased because of, just growth in positions with the standard HR schedules. We can certainly dig into it further and see what kind of increase there could have been.
Okay, thank you. I hope you do that for me. And so also the benchmark of increasing recruitment foster homes from 200 to 340, that hasn't even been moved at all?
Well, actually, the increase in recruitment of foster homes, separate and apart from the Council on Accreditation, that was something we initiated back in 2020, as I referenced in my opening statement, in terms of our efforts with the public and private agencies to recruit an additional, our goal was to recruit 100 families in fiscal year 21 and 100 families in fiscal year 22. So as of tonight, we're at 153. Our goal will be to exceed the 200 families by the time we get to June of 2022. We've already seen the impact of that. So certainly recruiting and having more additional foster families, whether they be traditional families or private agency families, has had a profound impact in terms of reducing the number of children going in congregate care placements. And I'm talking about children coming into care and ending up being able to be placed with a family as opposed to going into an assessment and stabilization center or a group care facility. So we've already implemented that approach as part of our right sizing of foster care initiative.
Okay. One more question, please, Chairman. So in past testimonies in past years, amazingly, I heard that certain number of children go missing every year, whether it's from runaway or whatever the case may be. Is there any of that going on right now, especially with, all we see about child trafficking, the disturbing trends that go on with this stuff? Do we have any kids that are missing currently?
Unfortunately, the answer to that is yes, there are. So in the nature of child welfare practice, particularly those youth that are placed in group home settings, do go what we call AWOL, A-W-O-L. We have designated a special investigation unit in Child Protective Services, 2 gentlemen that were former law enforcement agents. They have been working, and whenever a youth goes AWOL, they get notification of the youth going AWOL, and then they try to contact the youth. They've actually assembled a pretty good network of communication with many of these youth who frequently will go AWOL, and then they can locate them and contact them and work with the youth to try to get them to come back into care. But that is an ongoing issue for DCYF and has been an ongoing issue for a while. You mentioned the trafficking. That is a huge concern for any of our youth, particularly adolescent youth in DCYF care. So we have a number of youth. In fact, part of the Family First initiative allows the state to create residential programs or seek FORE support for residential programs specifically tailored to youth at risk of sex trafficking. So we intend, as part of our prevention plan, to identify several of our group care facilities who we will be asking to create specific programming to help youth and address the issue of the risk of sex trafficking for those youth. So yes, it is an ongoing issue. Unfortunately, youth are in group homes. They have access to leave the facility. And sometimes it's as simple as the youth has a curfew to need to be in by 7, 8 o'clock, and they come in at 9. That's one AWOL. Another AWOL is a youth who doesn't come back that night and stays with friends. So he goes with friends for the weekend. Some youth end up hooking up with their friends and don't want to come back into care. We notify anytime there's an AWOL, our providers in DCYF, we notify law enforcement, file a missing persons report, and then our 2 investigators in our Child Protective Unit will follow up on all those reports and begin the process of trying to track down our contacts to locate the youth.
Okay. I look forward to hearing more on that. Thank you.
Thank you.
All right, any additional questions? Well, I just have a couple just following up on Rep. Quattroci's questions revolving around the accreditation, because I know that does come up all the time. I haven't been here that long, but every year I'm here, we talk about the accreditation, and the Director of COIN, you mentioned that we can't move forward unless you have the support. So what support would you need from us to move forward with that accreditation?
Well, there would have to be a commitment both in the next fiscal year and the outlying years to fully commit to seeking the accreditation process. And in our report, Chairman, we identified, at least as of the time we did our review, which actually was done between May of 2020 and October 1 of 2020, we gave you our best estimate as to what the cost would be to fully receive accreditation over a 4-year period. And to be fully accredited, at least based on the staffing levels that we had at that time, would take approximate investment of about $10.8 million. Now, what part of that would be general revenue and what part of that would be federal, we'd have to assess. I don't think our report made that out. But it would require an ongoing investment of funding to support that certificate, council on accreditation.
Okay, if you can get the specific breakdowns, and our staff would probably be able to assist with that. But if you could also provide that information, the costs associated with it, because it is important to know the numbers, and if what's preventing you from moving forward with the accreditation is a set number, I'd like to know what that is. So.
Okay, very good. We could do that.
All right. Thank you very much. Any other questions of the director?
I think just one more question, Chairman.
Go right ahead, Rep.
It's not really a question. I'd like to see actually a breakdown of the department's efficiency with, the breakdown of the job positions and descriptions actually. And I mean, it's really, I guess, I'm not sure if it's our position to be doing an audit like that, but wouldn't it make sense to check the efficiencies, right? Can we get that information?
Oh yes, we can provide the job descriptions of all of our frontline positions, I would say, based on this discussion, in Child Protective Service, and that would include supervisors and administrators in Child Protective Service, and in our Family Service Division, which is the Case Management Division. Is that what you're looking for?
Right, but not only frontline, but others in the agency. Are they needed? Is it necessary to have whatever employee as opposed to having someone who is actually a frontline employee?
Right. So the staffing levels are representative within these divisions. Would include an investigator, an investigative supervisor, an administrator, an assistant director. That would be the staffing for our child protective units. And there's multiple child protection units because that's a 24/7 operation. In our family service units, you have a social worker, a social work supervisor, you have a chief of practice standard, and you have an assistant director that oversees approximately 28 to 30 case management units in 4 regions of family services. So when you see it, it's important to know the context to what the work is that's going on there. The job, and I got to tell you, I've been in state service 38 years. When you look at the job description, it'll give you a general idea of the type of work they do. But these are very generic job descriptions that Child Protective will be very specific. That is Child Protective. There's no other service in state government like it. So that will be specific. But the job description for social worker could be used in other state agencies. So it may not give you the full flavor of what they do on a day-to-day basis in terms of their case management responsibilities. But we'll give it, and then if there's further information you need, we could supplement it.
I appreciate that. Thank you.
Thank you very much. Any other questions? No questions. All right, Director, we are, I think, all set for the evening. We're going to the witnesses. So thank you very much. Matthew Gunnett. Hello, Matthew. Welcome to
Hello.
House Finance. You are on live. If you could just introduce yourself and then talk for a couple of minutes about your positions. Go right ahead.
My name is Matthew Gunnett. I'm president of SEIU Local 580. As the Rhode Island Alliance of Social Service Employees, we represent public sector workers at 9 state agencies. Our largest volume of members are at DCYF. We are the first line of defense of Rhode Island's most vulnerable children who are victims of neglect, physical abuse, and sexual abuse. As a social worker at DCYF since 2005, I've experienced the negative impact of our broken child welfare system that resulted in the children's rights lawsuit. This lawsuit resulted in a settlement, and the state agreed to engage in corrective action plans to reform DCYF. So far, the state of Rhode Island has failed to meet their agreements. 9 of 12 benchmarks have not been met. A corrective action plan to the corrective action plan mandated DCYF to complete a workload study. My understanding is that not only has the study not been completed, I'm not sure it has been started. While we welcome a workload study to dig deeper into our workload issues, we already know that we need more workers now. Other indicators of our need for more workers to reduce our workloads, in addition to the missed benchmarks in the lawsuit, our cases right now are much more acute. A case today is not the same as a case from 5 years ago. Why? Our investments in the community have diverted cases that used to be open to DCYF and are now managed in the community where they should be managed. However, this has also resulted in workers having to manage caseloads comprised of higher proportion of higher intensity cases. This can be demonstrated in how acuteness our cases are. The fact that we have a unit in one of our offices that consists of 5 workers and a supervisor. In this one unit, since January, workers in this just one unit have had, on 4 separate cases, had experienced infant death and 3 parents pass away. Another metric of the need for more workers is the Council of Accreditation report cited today. We truly appreciate DCYF's news tonight that 2 more units would be added for frontline workers, but there's more work to be done. For context, when I started in 2005, DCYF frontline workers in the Family Services unit had approximately 46 units, consisting of a supervisor and a small group of social workers. Today, we have approximately 30 of these same units. My interpretation of the House fiscal analysis is DCYF requested the governor filled 642 FTEs for this budget. However, only 627 FTEs are actually being recommended by the governor's budget. My hope is the executive branch, at a minimum, can find savings in other areas of their budget and bring those savings to the legislature so we can fund the initial requested FTEs. Every child fatality report over my 15 years at DCYF has recommended more frontline workers. We all want to be part of the solution to improve DCYF to avoid future fatalities. 2 last points. Our DCYF legal department is in crisis. I think the family court will concur with my assessment. Some attorneys lack child welfare experience, are frequently unprepared and inattentive. This has resulted in delays of children moving through and out of the DCYF system. Insufficient representation for our children and families has led to voices of our children not being sufficiently heard in the courtroom. The impact on worker morale has been significant. On a positive note, a well-respected, passionate, and committed DCYF attorney, Diane Leading, has been tapped and transferred to our main office in Providence to bring change to our legal department. We believe systemic change to our legal department could be made if these attorneys are held accountable in this change. Lastly, there's $500,000 approximately in the budget for savings at DCYF if DCYF sublease some of their office space. To achieve these savings, workers would need telework to reduce need for office space, and this needs to be collectively bargained with Local 580 and other unions. Local 580 is ready and looks forward to DCYF and state coming forward to negotiate so we can achieve these savings. Thank you for your time, and I welcome any questions.
Thank you, Matthew. Any questions? No questions? You're all set. We're on to the next.
Thank you.
Hello, you are on live with House Finance. If you could just introduce yourself and then talk about the bill, talk about the article or the department for a couple minutes. Go right ahead.
Good evening, Chairman Marzulkowski and members of the subcommittee. Thank you for the opportunity to testify. I'm Tanya Kubis, Meyer, Executive Director of the Rhode Island Coalition for Children and Families. I hope that you received my written testimony so that I might just highlight it. Our 41 members are all community-based organizations. We share the vision of DCYF for a system of well-being for children, youth, and families. We believe in a robust public-private partnership that is equitable in responding to the needs of all, that includes both a viable private community-based sector for flexibility, expertise, and innovation, along with a strong DCYF, as well as a continuous drive to quality through system-wide planning and outcomes evaluation. We're very grateful for our partnership with Acting Director O'Coin and his team. We have worked very closely with DCYF nearly every day so that children and staff could safely come this far through the pandemic, and we support the proposed budget, which continues to strengthen DCYF. We support appropriate caseloads, investing in the updating of an archaic data system, and we support investing in the public workforce to prevent foster care entry and to oversee care when children and youth need out-of-home placement. Our system is both public and private, however, and our services are complementary. The state agency is charged with policy and carrying out the legal requirements related to child safety and well-being and overseeing placements. The private community and service plans, as we heard. The private community-based sector is contracted to help stabilize families and prevent entry into care, to provide residential services, to provide therapeutic supports and behavioral health to children and foster families or in the community, and to help children and youth achieve permanent family and or independence. Private community-based agencies have the expertise and flexibility to provide specialized treatments, programs, and concrete needs to help keep families stable and children at home. Strengthening the state structure is critical. However, without ensuring the viability of the private sector contracts, the system will be incomplete, programs will be at risk, and services will not be available to meet the needs on demand. We have expressed our concerns to the administration, and we appreciate the budget constraints of this last year, the future planning underway, but we respectfully request that the subcommittee consider support for an addition to the budget of a 15% increase for DCYF contracted agencies for the coming year's budget. We make this request because we are experiencing a workforce crisis that is similar to those you're hearing about, including in the restaurant industry. Rates have been stagnant for several years, keeping wages low as other costs have soared during the pandemic, and wages in other sectors have increased. Staff leave our sector for other, frankly, less stressful work. Research backs up our concerns, and I've shared some key points about the diversity of our workforce and the average frontline pay in our sector. And I know that you're already aware of the behavioral health workforce crisis in our state that impacts our agencies as well. Our members employ thousands of staff cumulatively, and agencies are part of the sector. I provided you with some more data on the impact, both in terms of tax and fiscal importance of our sector. I think the point I'd like to summarize as quickly as I can is that we are proud of the work we've done together with DCYF, and the private agencies step forward every day. But our programs are being asked to support higher-end youth, and our members are finding that the youth that they serve have ever more acute needs. Despite the reliance upon them, as you've heard, numbers have been declining, and if fewer children need care, that's wonderful. But we need programs to be adequately resourced, and to be viable at smaller volume, rate adjustments are needed. We ask for your commitment to the public-private partnership and urge your support for both the DCYF budget and our request for a rate increase for contracted agents.